So these are my two responses to your first point. Thank you.
I want to add a couple of points on that. It's a very interesting question. There are a lot of repetitive tasks which a doctor does before the critical decision making is happening. Now, those repetitive tasks, for example, when did the pain start? What are the factors which make it better? What makes it worse, etc., etc. Now, time, almost 35%, this has been calculated in NHS, there's a trial. A junior doctor will spend 35% of time asking the same questions again and again and again. Now, what if a system is there which will collect this information before a doctor is meeting the patient? That's not replacing doctor, that is making doctor more efficient. In NHS, we run by cost efficiency. If I, as an orthopedic surgeon, do 4 hip replacements in a day without much complication track record, I can replace a doctor who is doing 3 a day with no complications. So in fact, it will create jobs. Those doctors who have started, as Dr. Zaki rightly said, AI will not replace doctors, but the doctors who are not using AI will become replaceable. If I can put it simple, I repeat, AI will not replace doctors, but the doctors who are resisting to use and learn AI can be replaceable. I'll give you one more example. A doctor normally rushes through the critical part of empathy. He thinks that most of the doctors at junior level think my responsibility is over when I've made a decision, I've given a diagnosis. No, it's not over. It starts because now you've got patient listening to you. That is the point you need to empathize. But where is the time? There is a queue behind. That is where AI will come and help and rescue the doctor. And remember, human working memory for the most intelligent guy is 4 or 5 items at 1 second, 1 nanosecond, one moment. Artificial intelligence has no limit, almost no limit. So imagine if you're diagnosing a condition, a poison, for example, somebody with symptoms, with mixed symptoms. Now you've got 5 or 6 options laid out in front of you at once, as compared to 2 or 3 from your own brain. There's no harm relying on AI and becoming a better doctor. And I totally endorse what Dr. Zaki said. It will make you better. And where will the computer say empathy? The computer cannot put a warm hand on your shoulder and say, you will get better. Only a doctor will do that. Thank you.
The other example which can be added to this conversation, and since Sohail and I are regular members and participants of these kind of conversations, so I was having this conversation with some senior people who have been working in digital health, and I kind of thought that how would you take a calculator who, it's a device which calculates at a much faster rate than a human being. But I don't think that calculators have replaced mathematicians or humans at all. I think this is a shift or a migration which physicians need to learn and get ready and very seamlessly adopt how to use the technology in their own processes. And that is why I chose an example of PROMS, which I felt that, which is already being used in the orthopedic space. The other example which I can share, again, for the interest of our participants, is a concept called Clinical Decision Support System, CDSS. And there are tools out there which are helping physicians to make a much better, actually a correct diagnosis. So I work in patient safety and quality healthcare as well. And we are also now integrating technology in patient safety. So we know that 10 to 20% of patients are harmed in a hospital. We know that diagnostic errors are common around the world. So physicians, and as Sohail said, that you have a long queue of patients, you have a very limited attention span, and you have to get things done. So if you are bogged down in very trivial and repetitive tasks, you do not have time to give to the patient. So technology actually enables you, or it frees up your time, which is not effective, and it allows you to spend more time with physician. And I think Sohail was referring to this concept that artificial intelligence actually will bring the humanization back to healthcare. So rather than having this conversation, which has a slightly negative connotation, that physicians get apprehensive or they get threatened that AI will replace them, and then what will they do? I think physicians need to embrace technology with this mindset that it is actually going to make them more humane.
That's a very healthy discussion, and we've had opinions and impressions from both sides of the both the involved parties, from the physicians as well as from the technologists and the AI people. So to sum it up, I think there's a lot of avenue, and there's a lot of space for us to evolve in this field. And the thing is that as physicians, we sort of get restricted to that daily seeing the patient's stuff, and we don't sort of realize that we don't take ourselves out and see the bigger picture, like Dr. Zaki has mentioned, that we've been overburdened, and we don't even feel that we have been overburdened because of this lack of referral systems where AI can help us reduce that burden, as Dr. Sohail correctly mentioned, to give us more time for our empathy. And of course, it's not AI replacing us, like Dr. Faiz Ali Shah has placed a comment in the comment box. A diagnostic and therapeutic efficacy, and I would add efficiency as well, will improve with the use of AI. And this will improve the efficacy of the treating surgeon. So this will be an advantage rather than anything else. So now we'll move on to questions and comments. And first of all, I see a hand raised by Dr. Masood Umar. So Dr. Masood, I would ask you to unmute and put your comment or questions.
Yes, Assalamualaikum. Thank you very much, everybody, for joining. My concern and comment would be on Dr. Zaki's statements, where he mentioned registries. So I'm also a big, very much into developing registries myself. My interest is orthopedic oncology, and I have been trying to develop a in-house registry, and was on the sidelines of the arthroplasty registry to see it develop. But Zaki Bhai, my question would be the impact that a registry was supposed to create after its creation, especially after 4 or 5 years, is yet to be seen. Is that because of lack of AI into it, lack of commitment? The registry has to have an impact on the population it is serving, and also give a feedback, useful feedback to the orthopedic community in this case, who are subscribing to it. And that seems to be a missing link right now. So if you can comment on that, please, and maybe Sohail Bhai also from the first world can answer how they have evolved into getting useful feedback by integrating AI into registries. Thank you.
Thank you very much. A very relevant point again. Why? Because as say, you also know that when this particular registry started, which you were also referring to, that you were part of that as well. Before that, in Pakistan, we did not have national registries. Yes, we had some institutional registries, but obviously they do not, fill the gap of getting data across. So some of us, including yourself, we took this initiative, and now, Alhamdulillah, we have more than 10 registries up and running. I will just give two examples responding to your question. One is of our experience in the cardiology space. We established a parallel cardiac registry of Pakistan called CROP. And, the Supreme Court took a suo motu notice, and then they mandated every cath lab in Pakistan to become part of that registry and share the data of each patient, which is going to have, these interventions. So now, Alhamdulillah, immediately we are getting this data from the cardiac registry, from diabetes registry, and many others which we are running. The second component of my answer to your question, which again is very relevant, and it also reflects upon the fact that I may have 100 papers, research papers, but you can come and ask me, what is the impact of your research? So we call it translational research. Now we know that most of our research in Pakistan is actually not translational research. It is research for the sake of research, for the sake of promotion, and we just, gather, do a small one, publish it, and then increase the number. There is no impact which is seen. But the example which I gave was actually around the impact. So what's happening is that, yes, we have more than 100 centers sharing the data of their patients. But even today in Pakistan, we did not know what to do with that data. Now, that's where, again, technology comes in. So if you link data analytics with registries, if you link prompts with registries, which I referred to in my talk before this, you will actually start getting the impact and the outcomes from this process of gathering data or gathering information in the form of a registry. So I think the missing link in the registries is that, yes, Alhamdulillah, at least we have achieved the first or two steps. Before these registries, we did not even have data. So we did not have the correct incidence or the prevalence or the, the mortality, the outcomes. We had no idea. So the first point is that now we are getting data. The second level, which now we are working on, which I gave an example of, is that we are bringing these prompts and the data analytics into the registries, so that in the coming years, we will have some meaningful information or knowledge from these registries, inshallah. So Dr. Omar, I hope this answers your question.
Can I just add, Dr. Zaki, to what you just said? Data management always, whether we use AI or we don't use AI, has two basic parts: the data collection and the data outputting. Now let's focus on data output. That is where AI can help. And I give you an example as an explanation. I worked on a study of knee varus deformity, which would have been operated for total knee replacement. Huge series of x-rays, more than 14,000 x-rays for 5 years to look at. So we developed a system where we can design the lines that this varus is 5 degrees, this varus is 6 degrees, this varus deformity is 7 degrees. So we designed a system which can pick up which was 7-degree varus. So if the AI system filtered out those patients which are operated upon by after 7 degree of varus deformity of the knee. That is where we saved a lot of time. So that is data management from the output side. And I want to answer your question very directly. Yes, AI can and will be able to help your data, provided you have a very robust AI system and a standardized, okay, for example, ECG, QRS complex, more than 3 squares. AI will pick that. Out of 1,000 ECGs you will see, AI will pick the QRS complex more than 5 squares, for 3 squares. So you only look at those ECGs first. These are your critical patients. These are the patients you want to make a separate group of. So yes, the answer to your question is, and this is being worked at, I'm involved at least in 2 projects on such level. One is the varus deformity of the knee requiring total knee replacement after the age of 50 years, between 50 to 65 years. That group we are controlling. And then there is something on the spine we are doing at the moment as well. But I welcome your question, a brilliant question.
There's one more question
you.
in the chat box, and that is targeted towards Dr. Zaki again. And the question says that you have mentioned the clinical decision support system. So they want to know where it is being used, if it's being used in the country, and can a public healthcare provider have access to these things?
Okay, thank you very much. One of the solutions which we are actually working on, unfortunately, you can say, is from, again, out of Pakistan. And that's where I think these collaborations between physicians and IT professionals and incubators can help us to have our own, local solution. But unfortunately, that's why I say unfortunately. But we are using one of the CDSS which we are using, and actually Aga Khan is using that for their medical students and training, is called Visual DX. It's a CDSS platform being used at around 3,000 medical schools and hospitals around the globe. And what it does is it not only helps us in improving our differential diagnosis, because you put in those signs and symptoms and other demographic information or patient information, and using the artificial intelligence algorithms behind it, gives you number 1, 2, 3, 4, 5 different differential diagnosis. And then it also helps you to study so that you could finalize based on your own knowledge and your local conditions. It also has a brilliant app which can actually just capture images, and then through those images gives you differential diagnosis. So the answer is that yes, we have some solutions in Pakistan. Unfortunately, these solutions are made in the West, but are accessible to us, and it is being used in Aga Khan in the medical college to teach students how to not only have more knowledge about different disease, but to have a better differential diagnosis practice.
Okay, so I think we are up to our time limit now. It's 6 o'clock, and it's been a healthy discussion, and it's opened up, I hope, avenues for orthopedic surgeons or the attendees to think and explore ways where they can use and adapt to AI, and probably take Pakistan into the future. And I hope orthopedics takes the lead and is the leader in terms of AI. So in the end, I would like to request Dr. Masood Umar for his concluding remarks for this wonderful webinar.
Thank you. Before I say that, thanks to all, I was trying to ask Dr. Zaki, have we engaged government at any level in this whole scenario? And has government of Pakistan shown any interest in developing AI-based, for example, registries or AI-based health improvement scenarios? I know you've been into this since many years, but has there been a response from the government?
Okay, it's a very important question, a very sensitive one too. So I think there are different components. One is the Ministry of Health, which is the custodian of healthcare and health systems and policies in Pakistan. And then there are different organizations which are not entirely governments. They could be called semi-government, or these are institutions like the Karachi University or CONSAT. So there are a few examples initiatives taken by these organizations, like Dr. Riaz, who's here, who's leading this Center for Health Innovation and using AI. But as far as I know, and as you mentioned yourself, that's been around 24 years for me in Pakistan, pushing and talking about telemedicine and now digital health with the government, trying to bring the government officially on board for digital health, not only AI, but the whole ambit of digital health. But I'm afraid that, unlike, the countries we have, so India, Saudi Arabia, UAE, and all the countries in our neighbor, and I'm not talking about the Western countries, all of these countries, they have dedicated departments, positions on digital health. So I think that I would have to say no. The government of Pakistan still, I think, is struggling to adopt digital health, and unfortunately still treated as an orphan area in healthcare. Other than these few examples which I mentioned, that COMSAT and other provincial governments are doing a little bit, but not at the national level, which is needed.
Thank you very much,
Thank you.
sir. Thank
Thank you
you
very much.
for all participants and faculty to join in and give this hour to us. And this was part of the webinar series from the platform of Pakistan Orthopedic Association and Pak Orthocon, which we will be holding next month. More important to me after this webinar is which direction to follow and where to go from here. So I guess that is the discussions like these would open bigger avenues and require deeper thinking on these on this subject, and maybe we can join again sometime into very focused questions and finding out solutions for them. That may be the way forward out of this today's webinar. Again, thank you very much to all my colleagues, faculty, and Kashif especially for arranging this webinar and bringing in all the faculty, and Sohail Bhai especially joining from overseas. Thank you very much. Assalamu alaikum.
Thank you. Assalamu alaikum.
Walaikum salam.